Are you a diabetic? In this video, we'll look at screening tests and evaluation needed to avoid complications of uncontrolled diabetes. Coming up. This channel is about tips and advice to promote your health and to keep you young. And if that's what you want, hit the notification bell and subscribe. This video is part 2, looking at uncontrolled diabetic complications. Click on this link above for part 1. Number 1, eye complications. You're at increased risk for cataracts, glaucoma, and vision loss. Another complication you want to avoid is diabetic retinopathy, where you have smaller bleeds into your eye. General measures to reduce risk and progression of retinopathy include good blood pressure control and good blood sugar control. I would recommend that you have an eye examination at least yearly with your eye doctor. Number 2, cardiovascular complications. Both men and women are at risk from developing and dying from these complications. Your life expectancy can be reduced by as much as 6 to 8 years. I'm sure you don't want that, and you want to continue enjoying a reasonable quality of life. Many patients with type 2 diabetes have other risk factors and markers of cardiovascular disease, such as obesity and high blood pressure and high bad cholesterol. And another huge risk factor is smoking. How can I manage these risk factors? If you're a diabetic and you're smoking, the most important thing you can do is take control of your health and to reduce, and better yet, quit or stop smoking. Number 2, you can take aspirin daily, and the recommended daily amount is 75 milligrams to 162 milligrams depending on which country you live in. Here in the US, it's 81 milligrams daily. Now, this is the recommended amount for you if you have an increased cardiovascular risk. So who are these people? If you have peripheral vascular disease, have had a heart attack, bypass, or stroke, or even a mini stroke. If you do take aspirin daily, you do have a slightly increased chance of a GI bleed. In certain individuals, the risks might outweigh the benefits. For example, if you've had a GI bleed in the past. If your cardiovascular risk factors are low, and you can have that discussion with your doctor, it is not routinely recommended that you take aspirin daily. Number 3, blood pressure control. Blood pressure control is important in diabetics. It is especially important to decrease the progression because you don't want diabetic kidney disease or diabetic eye disease. And diabetic eye disease is called diabetic retinopathy, and diabetic kidney disease is called diabetic nephropathy. And your treatment goal should be at least to have a systolic blood pressure to be less than 140 mmHg and a diastolic blood pressure to be less than 90 mmHg. If you have a lot of cardiovascular risk factors, the American Heart Association recommends that your goal blood pressure to be at least less than 130 to 80 mmHg. You have to remember these goals are general guidelines. The older you get, I do expect your blood pressure to go up, and you can have this discussion with your doctor what your target blood pressure should look like. Number 4, dyslipidemia or hyperlipidemia. If you're a diabetic, it is not unusual to have abnormalities with your lipid panel. The most important measure you can do to improve these abnormalities in your lipid panel is diet, exercise, and weight loss. Typically, a statin drug is added to treat these abnormalities, especially if you have cardiovascular risk factors. If you have been following my videos, I always encourage a non-pharmacological approach to control elevated cholesterol and other risk factors. You have to weigh in the pros and cons of statin therapy if it's initiated. Especially if you're an older adult, the risks might outweigh the benefits. Click on this link above and look at this video if you want to learn about statin side effects. Another staple of managing your diabetes are diabetic medications. Now, there are just too many to talk about, and it will require a video series or a series of videos to discuss. If you're interested in videos looking at different diabetic medications, leave your suggestions or comments below. Some of these medications would include metformin, a group of diabetic medications called GLP-1 receptor agonists, and SGLT2 inhibitors. Foot complications. At every exam, your doctor should look at your feet. He or she should check your feet, palpating your pulses and checking the sensation of your feet, checking for signs of diabetic neuropathy. Moreover, the foot exam serves to check for callus formation, fungal and wound infections, as well as checking for ulcers. Appropriate footwear should be discussed, as well as foot and nail hygiene. If your doctor believes you have problems with blood flow and blood perfusion, he or she will order a test to measure your ABI ratio. ABI stands for arterial brachial index. An ABI ratio between 1 and 1.4 is normal. An ABI ratio between 0.9 and 1.0 is borderline. An ABI ratio of 0.9 or less means you've got peripheral arterial disease. And an ABI ratio between 0.5 and 0.8 means you have moderate peripheral vascular disease. And if your ABI ratio is less than 0.5, then you have severe peripheral vascular disease. Number 4, kidney complications. Diabetes can harm your kidneys. This is because the blood vessels in your kidneys, as well as the tiny blood vessels supplying the filtering units of your kidneys, become damaged. Over time, because of high blood pressure, because of high blood sugars, these vessels become narrower and clog up. Your doctor with a blood test can check your renal parameters, as well as checking your urinary albumin to creatinine ratio. The normal rate of albumin excretion is less than 30 milligrams per day. If your value is more than this, 30 to 300 milligrams per day, this might be indicative of damage to your kidneys. And we refer to this as diabetic nephropathy. If the value is more than 300 milligrams per day, this is indicative of more severe damage to your kidneys, and we describe this as a state of proteinuria, meaning there's protein in your urine. Number 6, I would recommend at least an yearly examination with your dentist. As a diabetic, you're more prone to infection, and if you do have gum disease, it is more severe. There are a number of vaccinations which are recommended for diabetics. Number 1, it's recommended that you get an influenza vaccination yearly. Number 2, a pneumococcal vaccination per US Center for Disease Control and Prevention protocols. One is the pneumococcal conjugate vaccine PCV13 in adults above the age of 65, and a pneumococcal polysaccharide vaccine PPS-V223, which is given once before the age of 65 and then after the age of 65. Number 3, hepatitis B. The following are recommended lab tests which you can do and studies which you can do, which should be checked routinely by your doctor, which would include a lipid panel, hemoglobin A1C, a blood test called serum creatinine, looking at your renal parameters, and urinary albumin creatinine ratio. If you're interested in other videos, check right here, or check right here, or check right here. Think your health and have a good day. Oh my God. This channel is about I still can't say it.